It's hard work to become a nurse. There's lots of, you need to learn. There's lots of scientific things. You have to have biology, human anatomy and physiology, as well as there is math involved and medications, pharmacology, as well as you have to have your hands-on practical experiences. So learning to work with people and doing the skills involved in nursing. So it's half in classroom and half in clinical practices where you learn to be a nurse. There's a variety of places where nurses can work, but most nurses working in a hospital tend to do days and nights and weekends as well, because hospitals are open 24/7. So usually you work a day shift or a night shift, and it's all about sort of following the routine of a patient throughout the day. So in the morning, getting them up, helping them eat their breakfast, doing morning care, doing your physical assessments, providing treatments, procedures, ensuring they have lunch, dinner, and if you're working the night shift, you are helping them to get a good night's sleep because that helps them to get well again the next day. Nursing has changed over the years in that technology has become a more and more part of how we deliver care to people. So we have electronic health records nowadays, we have bedside computer charting, we have machines that do vital signs, and yet you still need to use all of that technology with your clinical decision making. So is the machine telling you the right number, and you need to assess the situation and determine where you use that information and how you use that information. You have to be a people person to become a nurse. You have to be able to work in teams. You have to learn to appreciate the skills that other people bring to the team. You work in partnership with doctors and physical therapists and occupational therapists and social workers. And it takes the whole team to help people get well. And that's true for not only acute care hospital nursing, but as well as nurses working in the communities and in clinics and all those different ways in home and community care, those types of things.